በቅድሚያ እንኳን በሰላም ለዚህ ቀን ተገናኘን። የአንቲማይክሮቢያል ሬዚስታንስን አብረን ኮሜሞሬት የምናደርግበትን ሳምንት አብረን የምናይበትና በተለይ ደግሞ በአራተኛ ዙር የሆነ የአገር አቀፍ በዚህ በመድኃኒት ሰውነቶቻችን መድኃኒትን መለማመድ እንዳይፈጥር ምን አይነት ስራዎች መስራት አለብን የሚለውን ዶክመንት በአገር አቀፍ ደረጃ በምንለቅበት በዚህ ከማስተዋወቅም ባለፈ ለህብረተሰባችን በእጁ እንዲደርስና ባለሙያዎቻችንም በዚህ እንዲጠቀሙ የምናደርግበት ቀን ላይ ስለመጣችሁ በቅድሚያ እንኳን ደህና መጣችሁ ማለት ፈልጋለሁ። በቀጥታ እንግዶቻችን በዛ ያሉ ስለሆኑ ወደ እንግሊዝኛ ቋንቋ ሽፍት አድርጌ መናገር ጀምራለሁ። It is a pleasure to be with you in this morning to welcome you to the beginning of the World Antimicrobial Resistance Awareness Week and also a launching of the Ethiopian new National Action Plan for AMR, the antimicrobial resistance. Your presence reaffirms our shared purpose and our shared responsibility to protect health and to protect our people. Antimicrobial resistance, as you have heard earlier, remains to be one of the challenging concerns in our globe. We call it even the silent pandemic. Some pandemics, you hear them immediately, but this is a silent pandemic that we will have to fight earlier so that we protect not only ourselves, but also the next generation. Around the world, resistance in infection is directly increasing and it's also causing around 1.27 million diseases associated with around 5 million diseases every year. This is called a silent pandemic because we don't usually have it being reported every day in many of the newses because you don't see it, we don't directly see it. It's only those who lost their family who would know what caused it. And also those who were treating the patients who would know what laboratory tests they have undergone and what they have got as an antimicrobial resistance. It is usually circulating between those who have the knowledge around antimicrobial resistance. The fact that we have everyone in one health architecture is this reason. It is a continuation of a link between the climate, continuation of a link between human and animal, and a combination of an efforts that we bring forth. If we do not act with urgency, this disease could really increase as research and data have been presented to us earlier also. By 2050, if we don't act, we have a tool in our hands, we know the way to act around it, but if we don't act, the estimates show that there will be a 70% increase by 2015, and the economic loss projected to exceed around 100 trillion US dollars, because this is more around care at an intensive unit, more and more medications to be produced, and needs R&D, research and development capacities. It is beyond what we're talking here. So if we do not act urgently, the challenges are affecting both health, agriculture, the environment, and the stability of the economics in the world. It calls for unity and steady and leadership. That's why, as a member of the Global Leaders Group, I am one of the members of the Global Leaders Group on AMR, and our chair being Her Excellency Prime Minister Maya Motali, where we work together globally for political action on AMR. This brings us to why we call for unity and steady leadership. Ethiopia has shown clear momentum on this one because we are addressing AMR, we're making it an agenda, we come closer with all stakeholders. You see Ministry of Agriculture, Climate Authority, we have all stakeholders, regional, national and global authorities discussing about this issue. We're also looking at what action plans we should put on the table on decision makers' hand. We successfully implemented NAPS, especially since 2009. We progressed from baseline assessment because the first baseline was in 2009 Gregorian calendar. This guides us now to the work we had from first, second, third, and now the fourth National Action Plan. The second was from 2050 to 2020. And then you can imagine the change after 2020, because then we had COVID. We took more lesson around the link between viral pathogens and the fact that they can increase more more burdened with antimicrobial resistance. This also brings me to talk about what would be the link with pathogens, pandemics, and outbreaks, viral diseases, and also bacterial diseases and antimicrobial resistance. Because beginning now with the next chapter from 2026 to 2030, we are now looking at both in our hands. Climate change, viral pathogens, virulence is increasing, and even now as we are fighting with Marburg and country, we need to look at what would this type of challenge increase to institutions. Climate is a risk multiplier, as we know, because anything that is impacting our One Health architecture, from animals who are migrating, carrying pathogens, to a risk that would increase to the community with mobilization, it is a risk multiplier. So there are several agenda points that we will bring climate into action. So today I will leave it just for us to think around why are we having AMR? Is it just because of our use only, or was it a risk multiplier? Second one is about emergencies fueling AMR. Viral outbreaks in health system will stretch, allowing the surge capacity we have, but also the surge in bacterial infections, because we will be more co-managing patients at this point. So this is a very critical point for us to look at. How do we approach our patients? Are we having our lab capacities more strengthened? Health system strengthening at large, so that we don't use the outbreaks in the health system, so that it stretches and allowing us to respond immediately, but also making it a place to fuel antimicrobial resistance. AMR also thrives on instability, and today's world really offers instability in abundance. So we have these three things in the globe. But what are the progresses we had so far that we should be proud of? One is we have seen 59% since the past three AMR guidelines. We have already the national action plans. We have 59% increase in AMR awareness by our professionals, particularly in our health professionals. So such actions that we do are really relevant, because people will start to read, what should we do? How do we work around it? Unless we speak about it, we don't usually recognize it. So 59% increase in AMR awareness was detected in our health professionals. And more than 54 media campaigns have reached to the public. But is it enough? But are we really making it an agenda? Because many of the drugs that we give for everyone are going to be in their hands. And the more we engage the community around AMR, the more campaigns we have, the more media engagement and awareness creations we do, everyone will understand why we're doing in AMR. I don't know how many of us in this room have completed amoxicillin before, and now how many of us in this room are shifting to azithromycin compared to augmentin, because we know the value we had in smaller doses, shorter days. But if we are already getting shorter with the type of antibiotics that we can give, you can imagine the number of research we would need so that we will have another drug that could be available. How many of us use one dose while the drug should have been for 7 days? I'm not going to ask us to show or to come forth, because we know it's deep inside. So AMR awareness is about this. Whatever a skip we do, whatever a resistance we're creating, is also creating a resistance for the next generation, because they will not have a drug in their hands that they can immediately use. We also recognize areas where more efforts are needed, because reporting remains inconsistent, and we have to really develop our data development. African CDC, DDG was also raising around this. We need both national, but also regional and global data more on AMR. Data inconsistencies and quality, and skilled personnel are also in short supply. We have to have access to quality microbial commodities, antimicrobial commodities, and this is part of the work we do in our Ethiopian Food and Drug Authority, but there are still loopholes that we have to strengthen around. Private sector engagement must increase, because this is where we need more data, more engagement, more awareness at the private sector, because there is no way that AMR is going to develop in a country and a private sector will be exempted and a public sector is not going to. So we have to work hand in hand, both at a private, a public sector, non-governmental, and governmental institution. The use of stronger antimicrobial use, policies for animals, but also for food system, are also very essential because we are having one planet that we share as one health. The challenges present also an opportunity for us on innovation and collaboration, but the purpose ahead of us is very clear. This year's theme, Act Now, Protect Our Present, Secure Our Future, reminds us that AMR is not only a current problem, but a work we need to do to secure a better health in the future. It is about the present one, but it's also about the future we want to see for our children. Every decision we make, every way we want to influence the next generation, but also our ability to prevent infection, safeguard treatment, protect families and communities, all play together. And a collaborative effort we have with quarterly meeting we have on a collaboration of all stakeholders will definitely be playing to this, but a daily technical brief, the monthly technical work we have with technical stakeholders are very crucial. I encourage each of us today here to lead by example because it all starts from self. How are we contributing to AMR? Because the best way is prevention. Prevent, prevent, prevent. And then if anything happens, if you need to take any antimicrobial resistance, make sure you abide with informations that are given to you by health professionals and many stakeholders who are engaged. Promote responsible antimicrobial use, strengthen infection prevention at institutions, beyond institutions, expand our surveillance, ensure data is visible and actionable, continue to educate and empower our community because it all lies at a community level. Small action, but consistently taken, would definitely change the trajectory we stated earlier, but can also entirely shift our national response, our regional response, and our global landscape. This week offers us an opportunity to learn from each other because we will be more diving in depth around antimicrobial resistance, another share for innovation, and also renew our shared commitment to protecting health of our country. It is a moment to listen, to reflect, but also to take strengthening the partnership we have so far and guiding our work together, especially as we are launching the fourth action plan. On behalf of the Ministry of Health, I want to extend my heartfelt and our heartfelt gratitude and appreciation to all partners, sectors, professionals who have been standing with us through this journey. Together, we will definitely continue to build on the momentum we have so far, but do better, especially on the areas that we're lagging behind. A resilient system that protects health for every Ethiopian, a health for a generation to come, and also a health for our continent and beyond. I thank you all.